Hey everyone, Dr. Mike here, and welcome back to the channel. Today we're diving into a topic that's incredibly important for everyone to understand: heart attack warning signs. Recognizing the signs and symptoms of a heart attack is crucial, as early detection can be the difference between life and death. Now, when we think about heart attacks, the first thing that often comes to mind is that crushing chest pain you see in the movies. While that's certainly a common symptom, it's not the only one, and many people experience heart attacks differently. In this video, we're going to cover 10 warning signs you absolutely can't afford to ignore. We'll break down each symptom, explain why it happens, and what to do if you or someone around you experiences it. Remember, knowledge is power, and understanding these signs could help you save a life, maybe even your own. So let's get started. Let's start with the most well-known symptom: chest pain. Now, this pain can feel like a heavy pressure, tightness, squeezing, or a burning sensation in your chest. It can last for a few minutes or come and go in waves. The important thing to remember is that any chest pain, especially if it's new or unexplained, should never be ignored. This pain occurs because the heart muscle isn't getting enough oxygen-rich blood. This can happen when there's a blockage in the arteries that supply blood to the heart. If you or someone you're with experiences sudden, intense chest pain or pressure, especially if it lasts for more than a few minutes, call 911 immediately. Don't wait, every second counts. Now, heart attack pain isn't always confined to the chest. It can radiate to other areas of the upper body, and this is where things can get tricky. You might feel pain or discomfort in your arms, especially the left arm, but it can affect both. This pain can travel down your arm, into your shoulder, back, neck, jaw, or even your teeth. The reason for this radiating pain is due to the way our nerves are connected. The nerves that supply the heart and those that supply the upper body share pathways, so the brain can sometimes misinterpret where the pain signals are coming from. So if you're experiencing pain in any of these areas, especially if it's accompanied by chest discomfort, don't brush it off. It's always better to err on the side of caution and seek medical attention. Feeling out of breath, even when you haven't exerted yourself, is another major red flag. You might find it difficult to catch your breath, feel like you're suffocating, or experience shallow, rapid breathing. This shortness of breath often occurs alongside chest pain, but it can also happen before or even without any chest discomfort. When a heart attack strikes, the heart struggles to pump blood effectively. This can lead to fluid buildup in the lungs, making it harder to breathe. Your body is basically sending you an SOS signal, telling you something is wrong. So listen to it. If you suddenly experience unexplained shortness of breath, especially if it's severe or accompanied by other symptoms on this list, call for help immediately. Breaking out in a cold sweat for no apparent reason is a common symptom that should never be taken lightly. You might feel clammy, your skin might feel cold and damp, and you might even look pale. This sweating is different from what you experience after a workout or on a hot day. During a heart attack, your body goes into fight or flight mode. Your nervous system kicks in, releasing hormones like adrenaline, which can cause sweating, even if you're not physically hot. This is your body's way of trying to cope with a stressful and potentially life-threatening situation. So, if you suddenly find yourself drenched in a cold sweat, especially if it's accompanied by other symptoms, don't hesitate to seek medical attention. Feeling nauseous or even vomiting might not be the first thing that comes to mind when you think of a heart attack, but it's a surprisingly common symptom. You might feel sick to your stomach, have an upset stomach, or experience waves of nausea. While the exact reason for this link isn't fully understood, it's thought to be related to the reduced blood flow to the digestive system during a heart attack. Basically, your body is prioritizing blood flow to vital organs like the heart and brain, and digestion takes a back seat. So if you experience sudden and unexplained nausea or vomiting, especially with other symptoms, it's crucial to seek medical help. Feeling lightheaded, dizzy, or faint is another sign that something's not right. You might feel unsteady on your feet, like you're going to pass out, or experience a spinning sensation. This lightheadedness often occurs because the heart isn't pumping blood effectively, leading to a drop in blood pressure. As a result, your brain might not be getting enough oxygen, leading to dizziness and lightheadedness. If you experience sudden dizziness or lightheadedness, especially if you feel like you're going to faint, Sit or lie down immediately and call for help. Don't try to tough it out, as this could be a sign of a serious medical condition. Feeling unusually tired or fatigued, even after a good night's sleep, can be a warning sign. This fatigue can come on suddenly and feel overwhelming, making it difficult to perform everyday tasks. You might feel weak, drained, or completely wiped out, even if you haven't been particularly active. This extreme fatigue is another way your body tries to tell you something is wrong. When the heart isn't pumping efficiently, your body has to work harder to circulate blood, leading to feelings of exhaustion. If you experience sudden, unusual fatigue that's persistent and unexplained, especially if it's accompanied by other symptoms, it's essential to consult a doctor. Now, this one might surprise you, but experiencing sudden, overwhelming anxiety or a sense of impending doom for no apparent reason can also be a sign of a heart attack. You might feel incredibly uneasy, restless, or agitated, even if you're generally a calm person. Some people describe it as a feeling of overwhelming fear or panic. While the exact link between anxiety and heart attacks isn't fully understood, it's thought to be related to the body's stress response. During a heart attack, your body releases a surge of hormones, including adrenaline, which can trigger feelings of anxiety and panic. So, if you experience sudden, unexplained anxiety, especially if it's severe or accompanied by other symptoms, don't dismiss it. You might be surprised to hear this, but some people mistake heart attack symptoms for heartburn or indigestion. You might experience a burning sensation in your chest or upper abdomen, feel bloated, or have an acidic taste in your mouth. While these symptoms are more commonly associated with digestive issues, it's important to remember that the heart and stomach are located close together. So, pain from one can sometimes be mistaken for pain from the other. If you experience heartburn-like symptoms that are new, severe, or don't respond to antacids, it's crucial to seek medical attention, especially if you have other risk factors for heart disease. Last but not least, a persistent cough that just won't quit can also be a sign of a heart problem, specifically heart failure. This type of cough is usually dry and hacking, and it might produce a frothy or pink-tinged mucus. It can be worse when lying down or at night. This cough occurs because when the heart isn't pumping efficiently, fluid can build up in the lungs, irritating the airways and triggering a cough. While a cough alone is not necessarily a cause for alarm, if you have a persistent cough that doesn't improve with over-the-counter remedies, especially if you have other risk factors for heart disease, it's important to see a doctor. That's it for our 10 heart attack signs you can't afford to ignore. Remember, early detection is key when it comes to heart attacks, and knowing these warning signs could potentially save a life. If you or someone around you experiences any of these symptoms, especially if they're severe or come on suddenly, don't wait. Call 911 immediately. It's always better to err on the side of caution and get checked out. Thanks for watching, and please share this video with your friends and family. Staying informed about heart health is crucial for everyone. And remember, live a healthy lifestyle, manage your stress levels, and get regular checkups to keep your heart happy and healthy.